Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience who are joining us from different parts of the world to another episode of Imamia Medic's International Women's Wing webinars. As you know that we have been following the series and we have been bringing you health awareness webinars for several years. And in this month, we have our very important Dallas chapter who also held the Imamia Medics International National Conference last year in Dallas. So the Dallas chapter today has brought to you a very significant awareness webinar on the topic of heart health. And we will be covering the heart health topic from the aspect of men and women both, inshallah. So we will begin the webinar without any delay with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Recitation. In the name of Allah, the Merciful, the Compassionate. Say, He is Allah, the One and Unique. Allah, who is in need of none and of whom all are in need. He neither begot any, nor was he begotten, and none is comparable to him. Sadaqallahul Aliyyul Azim. Once again, I welcome all the audience. Thank you for joining us. And you are watching us live on my TV, which is the YouTube page of Imamia Medics International. And this webinar is being brought to you by Imamia Medics Women's Wing Dallas chapter on the topic of heart health. I would like to introduce our moderators for today's webinar. First of all, we have Dr. Hina Rizvi with us, who is also the chair for the Dallas chapter. And I would like to officially introduce her. Dr. Hina Rizvi is one of the few wound care specialist physicians in the Dallas area who is board certified by American Board of Wound Management. She also specializes in hyperbaric medicine and is a member of American College of Hyperbaric Medicine. She completed her postgraduate training from University of Oklahoma Health Sciences Center in internal medicine and pediatrics, and her residency from UT Southwestern's Department of Family and Community Medicine. She also served as the chief resident there, and she is also board certified in family medicine. Dr. Rizvi was the medical student advisor and preceptor at UT Southwestern and has been involved with numerous publications. She has received multiple departmental distinctions and awards of excellence. She was a researcher at UT Southwestern and received awards including from Texas Academy of Family Physicians for the outstanding research. Dr. Rizvi is a patient-centric physician and is passionate about wound healing and limb salvage, providing quality care to her patients. Her experience includes successful healing of over 100,000 wounds and saving hundreds of amputations. We are honored to have Dr. Hina Rizvi with us, and along with her, we have her amazing daughter, Sister Zahra Jafri. I would like to introduce her as well. Sister Zahra Jafri is an undergraduate at SMU studying biology with a minor in Arabic. She is passionate about cellular and molecular biology research and conducts research at UT Southwestern and at SMU. Zehra is driven to enhance social and professional engagement among the local Muslim community and consequently works as a lead volunteer in the community youth group. She loves reading, writing, and playing badminton in her free time. I welcome Dr. Hina Rizvi and Sister Zehra Jafri. Thank you for bringing this webinar to us. Over to you.
Bismillahirrahmanirrahim. Assalamu alaikum. Thank you, Varda, for the kind introduction. We are very grateful for the entire team of IMI, especially Dr. Huma Naqvi and yourself, Varda, for the kind introduction and organizing such an excellent webinar, which really is the need of time. As we all know that the heart diseases are pretty much #1 cause of morbidity and mortality throughout the universe, and it's a very, very important topic. That being said, we are going to start our session with a short workshop of meditation and yoga conducted by Sister Shazia Akbar. As you all are aware, our lives are full of stress, and that's a major contributor towards the heart diseases, diabetes, and multiple comorbidities and mortalities. Just There are a lot of relaxation techniques, and yoga and meditation is one of the best to be able to combat the stress in our lives. I'm going to introduce Sister Shazia Akbar, who is a certified personal fitness trainer from National Academy of Sports Medicine. She's also a certified yoga teacher through Sunstone Fit and health coach. She runs a fitness studio called Z Fitness for Women. Her passion is to help the sisters live a happier and healthier life and encourage them to be part of the fitness industry. She's been doing it for the last 10 years. She teaches yoga, Pilates, and strength training classes in a comfortable environment where you learn how to create a strong foundation with correct alignment of yoga poses and exercise moves. Thank you. We're going to have a short video of meditation yoga sessions. So please follow along and you will see what a difference it makes in your overall stress situation and how relaxed you feel.
Bismillahirrahmanirrahim. Thank you so much for joining us today in this meditation practice. It's a video guided meditation. This particular meditation is titled Healthy Heart, yani Sehatmand Dil. During this meditation, you will find out the answers from your hearts. yani आज आप अपने दिल की आवाज सुनेंगे. Are you ready? Wherever you are sitting into a comfortable position, either you are on a chair or on the floor. तमाम distractions को अपने surrounding से free कर लीजिए and just focus on yourself. Place your hand on your knee and just relax your whole body. So we are going to start with a gentle breathing. Slowly inhale from your nose and exhale out through your mouth. Keep going. Inhale all the way up through your nostrils, your forehead, and the crown of the head, and exhale down. Open up the mouth. Couple of more. Inhale and exhale. One last time. Inhale and exhale. Place your hands on your knees and gently close your eyes. Keep breathing. Inhale and exhale. Inhale and exhale. Keep breathing and relax your whole body from crown of your head all the way down towards your toes. Relax your facial muscles. Relax the space between your eyebrows, the jaw. Drop the shoulder down. Relax your back, legs, toes. Everything should be nice and relaxed. Inhale and exhale. One more time. Inhale and exhale. दिल जिस्म का मरकज़ है. ये वो आज़ाए जिस्म है जो हमेशा मुतहरिक यानी मूवमेंट में रहता है. इसकी मूवमेंट हमारी हयात यानी लाइफ का सबब बनती है. ये दिल मोहब्बत की पनाहगाह है, एहसास का समंदर है, तहफ़्फ़ुज़ की चट्टान है. Our heart is a shelter for love, emotions and care. इसीलिए इस दिल का कवी होना लाजमी है. We thanks to Allah subhanahu wa ta'ala for a healthy cardiovascular system. Allah says in the Holy Quran, we certainly created man in the best of forms, yani ahsan takweem. Now we should ponder, हमें तफक्कुर करना चाहिए कि जब अल्लाह ताला ने हमें एहसन तक़वीम खल्क़ किया है तो हमारी जिस्मानी और रूहानी सेहत का ताल्लुक हमारे बॉडी से कितना स्ट्रॉन्ग है। बस इसी इंटेंशन को मद्देनज़र रखते हुए अपने हार्ट, बॉडी और सोल को कनेक्ट करें। Let's connect your heart, body and soul together. Keep this intention in your mind and try to keep your mind empty with all kind of thoughts. अपनी तमाम तवज्जो एक जगह मरकूज कर लें। Bring your attention together. Inhale from your nose, exhale out. Slowly flip your right hand and place it over on your heart. Just stay here. Sit on your sitting bone. Ground yourself. Bring all attention together in this present moments and ask your heart कि हम अपने दिल से कितना प्यार करते हैं, and we might get some answers. हमारा सेहतमंद जिस्म अल्लाह की अमानत है और इस अमानत की हिफाजत हमें खुद करनी है ताकि हम अल्लाह का शुक्राना अदा कर सकें। Now drop your hands back on your right knee. क्या हम अपने दिल को तंदुरुस्त रखने के लिए प्रॉपर डाइट को फॉलो करते हैं? हम अपने दिल को काम और रिलैक्स करने के लिए क्या अपने नींद पर तवज्जो देते हैं? Do we get good sleep? क्या इस दिल को मजबूत करने के लिए फिजिकल एक्टिविटीज़ यानी एक्सरसाइज रूटीन को अपने स्केड्यूल में प्रायोरिटाइज करते हैं? हमारा दिल बहुत कीमती है। इट्स सो वैल्यूएबल क्योंकि इस दिल में खुदा की मोहब्बत है, रसूल अकरम सल्लल्लाहु अलैहि वसल्लम की मोहब्बत है और अहले बैत की मोहब्बत है। क्या इस मोहब्बत को मज़ीद तवानाई बख्शने के लिए क्या हम अपने अमाल का मुराकबा यानी सेल्फ अकाउंटिंग करते हैं? You might have received the answers. शायद हमको हमारे ही दिल ने जवाब दे दिया होगा। हमारा सेहतमंद जिस्म और रूह अल्लाह ताला की तरफ से एक अजीम नेमत है और इस नेमत का शुक्राना हम हेल्दी लाइफ स्टाइल को अडॉप्ट करते हुए ही कर सकते हैं। जब हमारा रब अपने बंदे को किसी अजीम नेमत से नवाजता है तो वो अपने बंदे को कामयाब कर देता है कि उसके दिल में सिवाय खुदा के किसी की भी जगह नहीं होती, ताकि वो दिल क़ल्बे सलीम बन जाए यानी ए साउंड हार्ट। और ये दिल हमेशा अल्लाह ताला के शुक्राने से और सेहत के साथ और ताकत के साथ धड़कता रहे। या कवियो, या कवियो, या कवियो, या कवियो। Now slowly open up your eyes, smile yourself, Flip your palms towards the skies. Inhale, lift up. Palms together and bring it down at your heart. One more time. Inhale, lift the arms all the way up. Open the arms, palms going towards the ground. Inhale, flip the palms up and grab all positive energy around yourself. Bring the palms again and drop it down at your heart. Thank you so much.
Over to you, Dr. Hina.
Mashallah, thank you, Sister Shazia, for an amazing meditation session. I'm sure everybody benefited and for sure feel relaxed. I did, for sure. We're going to continue our excellent IMI Women's Wing session with our guest speaker here, Dr. Samreen Raza. We'll start with her introduction, who's going to enlighten us with the key topic and tell us about how the heart health is so important for everyone.
Dr. Samreen Raza is a clinical cardiologist with expertise in advanced cardiac imaging, including advanced echocardiography and cardiac CT. Originally from London, England, she earned her medical degree from the esteemed Imperial College of Medicine in London, where she graduated with a distinction with honors in medicine, clinical sciences, and surgery. She's been named Best Doctor by D Magazine for several years. Her focus is on heart disease prevention and women's heart health focus. She focuses as well on lifestyle, prevention, and nutrition. She has a busy clinical practice where she sees patients every day, and she lives in Dallas with her husband and her 2 children. To her now.
Thank you for the kind introduction. I'm humbled and honored to be with you all this wonderful afternoon. Special thanks and much gratitude from myself to IMI International for the wonderful opportunity to speak to you all, and for the Dallas wing of the women's wing of the IMI, who have just taken great initiative to present to us a great seminar which covers very topical and important information. So I think with that, I think Dr. Hina, we'll do a back and forth, I think. So if I'd like to kind of just turn it over to you, and I'll also share my screen for my presentation.
Okay, wonderful. Thank you, Samreen. So basically, our audience would like to know what are the key features to the heart health? Just a basic introduction, how the audience can benefit.
Yeah, so I thank you very much for the great questions. So I'll just give you a little bit of background. I see patients every single day, and it's really helpful to think about what you can do to try and reduce your chances or risk for heart disease. So this really is the biggest slide I'd like everybody to look at and take away with them. So we have many medications and surgeries and treatments in cardiology, but really it is lifestyle changes, both diet and exercise changes, which are the ones which have the greatest impact and also are the things that we should focus the most on. But as of course, given human nature, we think more about medication and surgery than we do lifestyle changes. Lifestyle changes can be more challenging. One of the biggest things that can be done to really help, a key element to improve your heart health overall, is exercise. So as we'd mentioned in previous seminars and also focusing on this one, we recommend, according to the American Heart Association, exercising for at least 30 minutes 5 times a week. This is what's beneficial to maintain your heart health. Why is physical activity so important? It helps your heart, your muscles, bones and joints, and it keeps your heart healthy and strong. And this is really what's recommended, which is moderate intensity physical activity. It also is shown to reduce your risk of heart attack and stroke, reduces cholesterol level, and helps improve and lower the blood pressure. And these are all physical inactivity is a huge thing that we are seeing much more as we see in our modern lifestyle. So it's really important to incorporate exercise in our daily routine. These are some examples of moderate intensity physical activity that's recommended for your heart health. You can take a look at the slide. Many of them include sport activities, jogging, walking, tennis, other aerobic type activities, and then things like soccer, even gardening and housework can also come under moderate intensity physical activity if they are done for a consecutive or a number of minutes in the day. Other key elements are smoking. So quitting smoking is one of the most important risk factors and a preventable cause of death in the US. So definitely do not recommend to start smoking if you're not already. If somebody is a smoker, recommend to quit smoking. And then also be very mindful of others' tobacco smoke. And this also includes vaping and other devices that people may be exposed to through passive smoking. As you know, it causes cancer, heart disease, lung disease, and many other issues. And then with that, I think I'll hand it back to Dr. Hina for the next question.
So our next question from our audience is, what type of diet or lifestyle do you recommend for optimal heart health?
So wonderful question. So I like to focus on this slide, which is thinking about some of the items I talked about previously. So we talked about physical activity, diet, keeping your blood pressure healthy and cholesterol. But I wanted to kind of focus really, I want to skip ahead to the diet. So thinking about the diet, choosing heart healthy foods is very important. Now, what does that mean? Really, we think about our modern diets, we're talking about eating lots of different variety of fruits and vegetables, different types of foods. For the heart, in specifically, we talk about things like olive oil, healthy fats, nuts, fruits and vegetables. You can take a look, and turmeric and garlic are also very good for the heart. And so what we like to recommend is for adults who are overweight or obese, we recommend to try and maintain weight loss through healthy dietary choices to reduce the weight. That's helpful. And then also eating a diet which is balanced in whole grains, fruits and vegetables, low-fat dairy products, and also eating enough protein, fish, nuts, and poultry like chicken, lean type meats. Also, it's very important to limit sodium and excess sugar and salt, and being very mindful about beverages as well. And too much excess red meat can also not be a good thing for the heart. So this is a lovely slide I like to show. So eating plenty of fruits and vegetables, adding in whole grains like whole wheat, whole grain bread, brown rice, oatmeal are very good sources of fiber. Eating fish, which is high in healthy fats. Salmon is a very good one. Limiting your intake of saturated fats, and thinking about when you're thinking about protein, thinking about lean meats and things which do not have as much fat or are grilled and well prepared. So as a visual, vegetables are good, fruits are good, nuts, whole grains, lean vegetables, animal protein can be eaten if it's lean, and then also considering fish. Things to avoid would be processed meats, trans fats, high fatty, high saturated fats, refined carbohydrates like white bread, white rice, junk food, and then also drinking beverages which are sweetened with sugar. So like sodas and other juices which have a lot of extra sugar in them. One other thing I like to mention is to really think about reading nutrition labels. This question comes up a lot. How can I make these healthy choices? So look at them, start looking at nutrition labels, look at sodium and total calorie content.
So now we're going to move on to our next question, which appears to be extremely important with the advent of what you were discussing, processed foods and sedentary lifestyles. So what are some of the signs and symptoms of heart disease?
It's a great question. Let me kind of jump to that. One item I wanted to discuss with everybody, and I'm going to get to your question in just a moment, is what we can think about in our Desi and South Asian community to try and reduce our risk in terms of healthy, choices. And I will answer your question in just a moment. So things to avoid are fried foods or saturated fat. We talked about these things. But there is a very interesting and very topical cardiology study called the Masala study. It's mediators of atherosclerosis in South Asians living in America. And this is a study which was try to understand those who are from South Asian origin, why do they have a higher risk for heart disease, heart attack and stroke compared to other racial or ethnic groups? And so what can we do to try and improve that? And so this was a very large study. It was done and published within the cardiology literature. The origin of the the participants was shown here on the map. And so it was kind of quite a wide variety. And there was many people from India, from Pakistan, from Sri Lanka, Bangladesh, of many different religious backgrounds. And so we understand that there is a higher risk in South Asians, and there may be different type of characteristics which are unique to South Asians, which is highly relevant for us, even those who may follow a vegetarian diet. What we recognize is that South Asians with a normal weight still can have higher risk for things like high blood sugar diabetes, high triglycerides or cholesterol problem, and also high blood pressure compared to other ethnicities. So the quality of the diet really matters as well. And then also eating, like we say, a diet high in fresh fruits and vegetables, avoiding very starchy products, eating things which are beans like legumes, dal. This is very good, healthy fats. Avoiding things which are including ghee, for example. This is a high fat type of compound which affects people's, which is a common incorporation in the diet. And then this also correlates to different findings and markers of heart disease. So this is a typical example, lots of different diets which are shown here. But all the different diets have different aspects to them. So in the orange box, we've got butter, ghee, and other fried snacks, high fat dairy, which we said is not good, refined grains, rice and potatoes. The Western diet also includes other things which are not beneficial, like extra pasta, refined carbohydrates, low fat, other dairy products, and extra caffeine, which can have an impact. And then South Asians also have more ectopic fat. So that means fat in other areas. And so then I want to talk a bit about the risk factors like we discussed. So I'm going to jump just quickly to some of the risk factors. So you mentioned, what are some of the things that we worry about? So I would like to just focus on this slide. So the biggest risk factors for heart disease we call them the big five. So we've got smoking, like we mentioned, high blood pressure, high cholesterol, diabetes, and other inherited like family history, And then I'd like to jump forward to thinking about what other signs and symptoms. So heart attack is a really, really important condition. Some of the warning signs are if there's pain in the chest, squeezing, uncomfortable, if there's a fullness in the center of the chest or chest pain that lasts more than a few minutes. There can also be pain or discomfort in one of the other of the arms or in the back, neck, jaw, or stomach. This can be an associated symptom for chest pain, shortness of breath, and also breaking out into a cold sweat, nausea, or lightheadedness. These can be some concerning signs or symptoms. Really, this is another way of thinking about it. What we're talking about is if there's any blockage inside the heart blood vessels, the coronary arteries. And then also I'd like to mention stroke, because stroke is a really important condition. Like you mentioned, other things that people should be thinking about are if there's sudden numbness or weakness in one side of the face or the arm or the legs, or if there's sudden confusion or trouble speaking or understanding a person. This could be a sign that somebody's having a stroke. Vision changes or sudden trouble seeing in one of the eyes or any sort of vision change, that's important. And then difficulty in walking, dizziness in balance or coordination, or a sudden severe headache with no other good cause, So these are some really important takeaways to think about when it comes to stroke and heart attack. And really, it's important for the US audience to call 911 and get medical attention as soon as is possible.
Thank you, Dr. Reza, for your extremely thorough and very detailed answer, especially in pertinence to the South Asian community. That information is very important to be dispersed. So within that same vein, what are some of the risk factors to a heart attack?
So
a little bit, but now we can just
I want to jump in to. I know we'd received this excellent question from our wonderful audience. It's so important that people are thinking about these types of things. So I mentioned this. We talk about hereditary or family history. This is so important. But hypertension, high blood pressure, cholesterol is, high blood cholesterol level. We call it hyperlipidemia or triglycerides, which are elevated. This is a lab type marker. Diabetes is a huge risk factor for heart disease, but other things that contribute are sedentary lifestyle, not exercising frequently. And then also we do have some other risk factors, which really include, we talk about age-related, high cholesterol, family history, if there's a relative, first degree relatives that's had a history of early heart attack, for example, mother, father, sibling, or child, if any one of those family members has had an early risk of heart disease or heart attack event. We also think about other factors which are unique to women and men too, but menopause, for example, the risk for women increases as a woman ages. So this is increased as time goes on. Metabolic syndrome, which is encompassing like cholesterol, being overweight, blood sugar abnormalities, and then other types of conditions which are associated with inflammation, autoimmune disease, or chronic kidney diseases. This also increases the risk for heart disease as well. So one of the things I like to mention in terms of risk factors is thinking about high blood pressure control and thinking about how important that is. Hypertension is something that we focus on as cardiologists very much. So we're talking about what is good blood pressure control. So this is a big risk factor for heart disease that kind of alludes to your question. And it's so important that we think about how we can control, our blood pressure. Diabetes is a big one too. So diabetes and lifestyle, why is diabetes bad? It's because it can cause problems in the heart. It can increase the risk for stroke. It can be associated with high blood pressure. It can lead to organ damage like blindness, damage to the nerves, damage to the kidney, even circulation problems and foot damage, and sometimes can lead to amputation and other nerve type issues. And so this is, as many people know, it's a sugar-related issue where there's a high blood glucose level. And this is something that is treated with, ideally with lifestyle and dietary control, but some people may require other medications and insulin treatment. But these are the big highlights on the big risk factors for heart disease.
Thank you so much for reiterating the risk factors, Dr. Samreen, because if we can keep those under control, I think we can avoid a lot of those heart diseases, which are very common these days. I know you told us that menopause, women who reach menopause, they are at higher risk for heart attacks. Do you want to shed some light a little bit on menopause in women's heart and how women can protect it?
Yeah, it's a great question, especially so what I've discussed is applies to both men and women. So men and women should both incorporate lifestyle and diet changes, think about their risk factors, if there's high blood pressure, cholesterol, or family history. But with women in particular, we do recognize that when the woman is before the age of menopause, their hormone cycle is different to after menopause, okay? This also correlates to a person's aging, so a person is older in most cases when they are hitting the menopause age compared to when they're in reproductive age or when they're in childbearing years for women, So because the hormones that are in younger women who are premenopausal, they have a protective effect from the estrogen, which is the main female hormone which exists, in women. So it provides a little bit of protection in women before the age of menopause. Now, when a woman is older, I say that very nicely, age is a spectrum, so when a woman reaches the menopause age, what we find is the effect of the protective estrogen, the hormone, then goes away because naturally it will reduce with a woman's age. But then what happens is the woman is also chronologically older. So therefore, other conditions can develop, such as high blood pressure, cholesterol problems, and also age-related because the person is older as well. So the risk for heart disease increases with age. So the biggest things that women can focus on are really on their lifestyle. I'm a huge fan of lifestyle. So exercise routine becomes even more crucial. Portion control and maintaining a healthy weight, especially thinking about the middle section. We talk about obesity around the belly, midsection, weight gain. This is a very important risk factor. And then also weight training. So exercising of the right kind. We find is over time, especially for women who are postmenopausal, the muscle is lost and it becomes replaced with fat. We're talking about the muscles of the joints, like on the arms and your legs. So it's really important for women to do some weight training and also some physical activity exercise that helps build their muscle mass and also to help condition their heart so their heart is healthy as they go into the postmenopausal age.
Thank you for your answer. That was very well detailed and well researched. Our next question, and now we're going to be pulling these from the audience. The first question is going to be, is using sweeteners like Splenda or stevia instead of sugar a healthy option for patients with hypertension or diabetes?
It's a good question. We're talking about things like aspartame, other types of sugar sweeteners, or sugar substitutes. I would say that my view is that first of all, it doesn't have anything really to do with the blood pressure because that's really more sodium related components, so less effect on the blood pressure, but it really can have an effect on the blood sugar, and so what we want to think about is it doesn't have, at least in my view, an obvious benefit, and we think about nutritional value too, so it's best to incorporate things in your diet that are adding some value for your heart health. And I would say that in my view, for example, something like honey or a natural compound, like a natural sweetener would be more beneficial because it would give you some nutritional value, but also some general heart health benefit. Looking at the studies, for some people who have difficulty, a sugar substitute could be used in place of a sugary substance, for example. So it would be better than having something which has sugar in it. But I would say that, in my view, things like honey or brown sugar or unrefined sugar sources would be a better source of something sweetener rather than artificial compounds.
Wonderful. Thank you so much for this is a very important question, as a lot of people ask that, and I'm sure it answered a lot of the audience. Another question from the audience is that how important is stress management in the prevention of heart disease? And that's why we actually had the yoga meditation workshop to be able to look at the ways how we can combat stress in this very busy lifestyle that everybody has these days.
Yes, stress is such an important thing to consider. Of course, as you know, it can affect so many different things. Stress can contribute to poor sleep, which can have an impact on many other medical, conditions in your heart health in general. It can also contribute to high blood pressure if you're stressed and it's out of control. Stress management is such a huge thing, especially in people's very busy and fast-paced lifestyles. It's so important. So we see conditions which are related. There's something called stress cardiomyopathy or Takotsubo cardiomyopathy. It's a type of heart condition, also sometimes known as broken heart syndrome, which is a type of condition that's actually affected by the stress hormones in the body. Emotional stress is still considered a huge aspect for heart disease and sometimes a precipitant for heart attack and heart episodes. So stress management is such an important thing, especially in this day and age. And it's so important that people gauge their personal stress level and do what they can to reduce the level of stress and to try and implement healthy routines that reduce their stress level. It can be a huge important factor. I see many patients on a daily basis, uncontrolled high blood pressure, poor quality sleep, stress hormones which are out of control. These can have a real physical impact in some patients and some people.
Thank you for your answer. So moving on to the next question, is using brown sugar or jaggery good, better for diabetes, or is it a good alternative?
It's a good question. I think it's always good for people to think, consult with their physicians, their primary care physician, GP, or a diabetes specialist that they may be seeing. I would say, yes, I do think it would be a better alternative to, for example, processed foods or white sugar, like just pure cane sugar, because it's broken down in a slightly different way. And I think it would be a better alternative, yes. In moderation.
In moderation, of course. How about honey, since we are talking about
It's a great question. So according to, of course, a lot of research comes out, but according to what's the generally accepted sort of consensus when it comes to different types of foods and items, honey has been looked at in many different ways. And to the best of my knowledge, it can be used as part of a heart healthy diet, and it does not spike the blood sugar in the same way as, for example, unrefined, or just pure cane sugar would, for example, or processed foods. That causes a more intense spike in your blood sugar level, which is not something we want. It affects the heart system and the whole body in a not in a good way. Honey has a different, what you call, glycemic index, which is where the way that the body will absorb the compound, and it's not as far as to the best of my knowledge, it can be used in moderation as part of a heart healthy lifestyle, and it could be beneficial to those who are thinking about an alternative when they want something sweet and they may have a blood sugar issue or they may have diabetes.
Good, a very good question, because I was aware of one of the research topics about dates. Just like Prophet Muhammad had always stressed the importance, and I mean, he used to have it sunnah to have dates and honey both. And what Prophet Muhammad had told us like 15 years, 100 years ago, it's all proven by science these days. For example, olive oil, everybody knows how healthy it is, and uska zikr Quran mein hai. And honey, and pomegranate, which everybody's going crazy that it's antioxidant, and how anar ka zikr, it's in Quran. And figs also, that's a great example how healthy it is for the health. And dates, I think, similar to honey, has a lower glycemic index, which I came across just recently because I
Yeah.
was trying to avoid some dates, and I went through this research article which showed that the dates does not have a very high glycemic index, which can be taken in a moderation, of course, in patients who have diabetes. So thank you so much, Samreen. It's a very good question, actually, just came from the audience, which is going to really help us understand this better. Does family history of heart disease matter the same for men as it matters in women, or is there any one is at higher risk than the other?
They both are equally important, and it really the gender. It's if you have a first degree relative that has had early heart disease history, you do carry a slightly higher risk, for heart disease, and it can run in families. I'd say that for both men and women, it's equally as important, We tend to think of heart disease as more of a man's disease, because we think of it in the movies, or, you may have heard of more men having heart disease, but actually women's heart, it's the number one killer of women. And it's so important, number one diagnosis. It's so important to focus on women's heart health as well. So I'd say they're equally as important. So if you have a sibling, a parent, a first degree relative that has early history of heart disease or a heart attack or a stroke, it's important just to get yourself checked out, and so you can understand what your risk is for heart disease, and like I mentioned with the risk factors, earlier in the presentation, in thinking about blood pressure, blood sugar, cholesterol level, your own family history, really thinking about it so that you can then focus on what your risk is for heart disease and understand that more.
That's wonderful. We're getting amazing questions for our very, very educated and very smart audience. A quick question just came, which is an amazing question, that if somebody wants to watch their health for heart diseases and want to stay healthy, I know we talked about the exercise and diet and the excellent nutrition that we have to follow. For preventative health, what kind of blood test can they do to make sure that we keep our heart health in check, and how frequently?
Yeah, it's a great question. So first of all, I would take you right back to focusing on weight. Okay, so a person should know what their weight is and understand what that is in context to their height, and also to know if it's in a range which is excessive or if it's under control. So that's number one thing. Number two is blood pressure. So knowing what your blood pressure is, everybody should know what their blood pressure is, and so they should know if it's running high, or some people have a low blood pressure, but really the higher blood pressure is the one that we think of, which is associated with heart disease. Number three is cholesterol. Okay, so this can be checked really on once a year, or whatever schedule people generally will see their primary care physician or GP or their personal physicians. And this can be checked very easily with a blood test. If the cholesterol level is high, it's really even more important to think about diet and exercise and lifestyle factors that can help reduce the risk. And as a cardiologist, what I would do is I would, in general, talk to people about doing what we call aggressive lifestyle control, which is we're really focused on exercise and diet and weight loss, which we understand is connected to cholesterol level. And so this would be one thing to modify initially. The third, fourth, and fifth things would be then we get more into advanced type testing, And so in my view, thinking about heart disease from a preventive standpoint, there are some blood tests that can be done to help to kind of understand a person's risk, for heart disease. One of them would be we have specific markers that can be checked in the blood work, which are available in the US, and they are likely available across Europe and in the UK as well, which really think about if a person has a higher risk for heart disease. Now, we don't universally check all of these markers because it has to be very focused on the individual themselves, but there are some specific markers. And then there's something called a calcium score test. So this is a type of screening test for heart disease that we utilize here in America and likely across Europe as well. And that test is looking at if there's any actual buildup or plaque around the heart blood vessels, and it gives us a score number. And so the score number then correlates to whether there is a presence of early heart disease buildup, and then we can make decisions about what to do for that individual. The other marker that can be considered is, for example, ultrasound of the neck, carotid artery scan. So everyone knows that your brain and your heart are connected and you have blood vessels through the body. And so we can check a special ultrasound of the neck to see if there's any buildup or plaque that's present that then could have an impact on somebody's risk for heart disease. And we also talk about medications, for example, that would also relate, medication discussion would also relate to blood work, for example, as well. But really having a proper consultation with a physician, your personal physician, and also a cardiologist that focuses on prevention, like myself, for example.
Thank you for your answer. The next question is going to be, should aspirin be taken prophylactically on patients without heart disease?
It's a great question. So the more recent literature, so first of all, I will say is it depends on, it's a one-to-one discussion. So it's a very personalized type of discussion between physician and patient, to decide about what a specific person's decision might be. But we don't universally recommend aspirin in people who do not have any evidence of heart disease, okay? But it is important to consider, for example, in people who are, let's say, women above the age of 75, we can have a discussion about it for help reducing the risk of stroke. For people who have abnormal calcium score, like I mentioned, that test I was telling you all about calcium buildup or coronary atherosclerosis or buildup, calcification around the heart blood vessels, aspirin can be considered in some cases, or things like peripheral vascular disease, PVD, which is diseases of the blood vessels of the arms or the legs or the neck. In some situations, aspirin can be considered there. Aspirin is still a very kind of cornerstone medication in the cardiology world because it helps reduce, it's called an antiplatelet agent, which helps prevent the clotting or the binding of platelets within the body. And it's been shown to reduce the risk of heart attack, but it's not universally recommended, especially for people who do not have evidence of heart disease buildup.
Thank you so much, Maureen. It's a very, very nice and comprehensive answer. Just a couple of more questions. Alhamdulillah, we are doing very good with time. One question is that sometimes, a lot of new research going on these days. अभी recent research थोड़ी है कि असली घी is definitely much better than the vegetable oil or canola oil or whatever we do. That's one question. The other question that comes up pretty frequently is that in 1990s, everybody used to say that eggs are very bad for you because of the cholesterol in the yolk. But now more recent research says that the cholesterol, which is about, if I'm not wrong, 250 milligrams of cholesterol in the egg yolk, that is really not bad because our cells are actually made up of, the cell membranes are made of lipids, and we need some kind of healthy cholesterol, which is present in eggs. So what's your advice on that?
Yeah, so I would say that first of all, ghee, like I mentioned, with the other study that I talked about related to South Asians. So ghee is a form of a saturated fat, and we're very much used to using it in our cooking. I would say that a better version would be like olive oil. I know it's not the same, and it does take an adjustment to the palate. It's not exactly the same for recipes, but olive oil is better. It's shown as part of what we call the Mediterranean diet, which is not likely the diet that most people follow, but there are components of this diet which are beneficial, just like you mentioned earlier, olives, olive oil, these healthy fats, nuts, etc. These things are shown to be beneficial. So I'd say limit fried foods is one thing, and limiting any extra oil component just in general. We'd include butter as part of this, ghee in general, and canola, this kind of these types of vegetable oils. Just limiting them would be beneficial, but increasing or adapting to things like olive oil and other types of healthy seed, healthy type oils, which are beneficial to the heart, would be better. And avoiding just in general, like fried foods, the grilled is better, limiting the amount and quantity of this of fried component or extra oil that's in the diet. And then coming to your second question or second component of the question, which was, can you repeat just the second part of your question again? The
Yeah, right. So like I would say 10 years ago, everybody used to say that
egg.
eggs are
Yes,
good,
yeah, yeah.
low cholesterol in the
You got
human,
it.
but
Yeah.
it's more like it's healthy cholesterol that we should.
Yeah, right. So it's a great question. This I will say that the majority of cholesterol that's affected that by the heart, and we talk about plaque and cholesterol buildup. A lot of that is more tied to things like dairy, milk, cheese, these types of things contribute in a larger portion to the triglycerides that can have an impact. With regards to egg can still be a good source of protein. And I would suggest to obviously try and use healthy oils if someone is frying or preparing the egg. Egg white is also can be a good source of protein. So I'd say egg white is another good option. But if somebody is limited in their choices of protein, egg does provide protein. So again, it's a balance. It's a topic that comes up from time to time, but the body has its own ways of getting the cholesterol that it needs for cell membranes. That actually process is done more from within the body rather than from dietary sources of cholesterol. So the portion of cholesterol that comes from the dietary component is actually a smaller percentage compared to that which is what we call produced endogenously, from within the body process, like the chemical process and reaction that the body produces. So I'd say egg can be eaten as part of a heart healthy diet, just in general, again in moderation. But if there are other dietary restrictions, like for example, if that's a big component of protein, it can be taken, it can be eaten. Things like a boiled egg, avoiding fried eggs, and maybe adding more egg white might be more better choices.
Thank you for your answer. So our last question from the audience is going to be, any early symptoms of heart attack or heart disease? Are there any early symptoms of a heart attack or heart disease that we should look out for if someone is at risk or just in general?
Yeah, I would say that a few things. Number one is before it becomes to the symptoms, your body's really smart, right? It's going to adapt over several years before it reaches a point where it's going to have significant symptoms, because it's going to adapt, it's going to keep evolving and adapting. So the things that I would say to focus on are thinking about how healthy you are. How healthy am I? Am I exercising? Am I overweight? Do I have my numbers are in check? Is my blood pressure okay? Have I had my cholesterol checked? What's the number? So these are first of all sort of reflecting within to see what is the situation. The second thing I would say is if you're being active, things like excessive shortness of breath, like breathlessness with that physical activity, is really an important one. Things like if you're doing housework, for example, you're carrying the laundry basket from upstairs to downstairs, and you're finding that that's becoming more difficult. That's an important one. Number two is if there's any heaviness in the chest, any chest pain, chest discomfort, could be a potential sign or symptom of heart disease. These are the big ones. I'd say shortness of breath and chest discomfort. This would be the two things I would take away. The other thing I'll mention for both men and women, more so in men, I will say actually is leg pain, for example. So if a person is not able to walk, for example, for a period of time, or having pain in the leg with exercising or walking, it could be muscular, or it could just be that the person is not drinking enough or they're dehydrated. But sometimes there are some blood vessel diseases that affect the blood flow to the leg that can show up. So leg pain, loss of hair in the leg, for men, loss of lower leg hair, which this could be a sign as well. And then like buttock pain in the lower leg, pain in the buttock with walking or exercise can also be a symptom. But the biggest things would be shortness of breath, chest pain, unusual symptoms, unusual difficulty or fatigue doing physical activity, and then the other items that I mentioned.
Alrighty, thank you so much. So In wrapping up our session, right off of the bat, I would like to thank you, Dr. Samreen Raza, as well as Sister Shazia Akbar, for our amazing interactive sessions that we all, I believe, really benefited from. So in closing out, I'm going to now hand it over to Dr. Rizvi and thanking our last couple speakers.
Thank you so much again, Dr. Samreen, for the amazing session on heart health, and also Sister Shazia Akbar for a very nice interactive meditation session, which we all need in our daily stressful life. I would like to also thank the entire IMI team, including Dr. Huma Naqvi, who's our president of IMI Women's Wing, and Dr. Nazneen Zadi from IMI Women's Wing, as well as Sister Warda Batul for organizing the amazing session. IMI Women's Wing arranges at least 1 to 2 sessions every month for preventive health and medicine for women's health around different topics, which are the key topics these days, like I remember the last topic we had was about cancer, how common that is, and what's the main effect of how the genetic components and everything kind of contributes, and how we can prevent it by our screening tests. So we have amazing, and I'm sure the audience benefits. These kind of sessions are pretty much live throughout the universe, globally, in Pakistan, India, different countries, Europe, England, Canada, Australia. People are able to review and are able to benefit. And I think IMI is doing just an amazing job. I would also like to thank the IMI media team, Brother Usher, who's always has been a very important component of the team, in which we are able to kind of focus on all our media and sessions that go all around Facebook, LinkedIn, and different areas. So I really appreciate from the bottom of my heart all the speakers and IMI entire team. Thank you again.
Thank you very much, IMI Women's Wing Dallas chapter, for bringing us this very informative, very engaging webinar. And I'm sure most of our audience would have learned a lot. We here as a team have learned a lot from our guest speaker, Dr. Samreen Rizvi Raza and Sister Shazia Akbar. So we'd like to once again extend our thank you to all the team of the Dallas chapter and Imamia Medics International Media team for bringing us this webinar. And for the next webinar, we'll see you inshallah next month. Take care till then. Allah Hafiz.